Hughes Spaulding Pavilion opened in 1952 as a training hospital for black doctors, but 29 years ago, most of Atlanta's doctors were white. They could not treat their black patients at segregated Grady Hospital, so they sent them here. Then the civil rights movement opened Grady's doors to blacks, and Hughes Spaulding faded into the background. 1/3 of its rooms are no longer in use. Half its 80 usable beds are empty. Intensive care is all but deserted. Obstetrics has been closed. The hospital is losing $200,000 a year. A consulting firm has come up with a $7.4 million plan to save the hospital by converting one floor to psychiatric care, adding an emergency admitting room, and upgrading other facilities. Fulton County has agreed to float a bond issue, but hospital administrator Charles Wilson must first convince regional health planners that the new services will not duplicate those at Grady.
We do not feel that it would be in competition with Grady Hospital, which is 1 block away, because we are not trying to compete from a trauma standpoint.
But do you have to compete with Grady Hospital for funding?
No. We are to be a self-supporting, self-sustaining hospital.
If the renovation plan is approved, Hughes Spaulding would become a teaching hospital for Morehouse Medical School. And that's one of the arguments officials here use to show that they no longer wish to be thought of as a black hospital. The future doctors being trained in the Morehouse student body are 40% white, 60% black, and 50% female. For Good Morning Atlanta, this is Terry Anzur.